Our next guest speaker tonight is Dr. James Kincannon. He has a PhD from the University of Minnesota in clinical psychology. He has 8 years at the St. Paul Ramsey Hospital as a clinical psychologist, the last 3 years of which serves as director of drug dependency service. He is currently director of the Hennepin County Meadowbrook Treatment Center. He is a faculty appointment of the University of Minnesota Medical School and Department of Psychology, and is currently a teacher at Augsburg College. Dr. Kincannon.
Thank you. And Dr. Peterson did a very good job of covering so much that I'm just going to take it from there and start out with a very brief summary of a few points that he had made. And then I'll want to follow a particular kind of model, and there are two things that I want to get to. What happens to a person once he has a drug dependency, and we tend to call that maladjustment. I'm not talking loud enough? Thank you. We tend to call that maladjustment, and then talk about how one may do something about the fix he's in, or what we can do to work with the situation. But the way I particularly like to handle it, because I feel this is the appropriate way, is to view the problem as basically a public health problem, a problem involving people in an environment, much as Dr. Peterson pointed out, and the involvement is somehow or other influenced by a particular kind of agent. Now, this is a standard kind of model for all public health problems, whether it be venereal disease or measles or drug dependency or even poverty, where you have an agent, and in the case of the drug dependency, it's drugs, and these were well described. These were drugs like the depressants, alcohol, the minor tranquilizers, and the sedatives, which are all legal drugs and constitute far and away the primary drug problem. And they're the practices of the legal purveyor of drugs, as Dr. Peterson pointed out, are frequently no different than the practices of illegal purveyors of drugs. Now, in the poverty thing, just to make my analogy, is the agent is the fact that we systematically deprived impoverished people of the mechanics to get out of their situation. We deprived them of education, of any kind of political power, or any kind of economic lever to get out of the particular pickle they're in. Now, the second ingredient, first the agent, you have the host, which, as Dr. Peterson turned out, can become master. You know, pleasure enters the home as a guest, stays on as host, and soon becomes master. Well, the host in our problem are individuals. And then in the poverty scene, you know, we have a social Darwinism. We assume, you know, that only the unfit fall into this category, which we now know is not a truthful statement. Now, the third thing is the environment. And I have to agree with Dr. Peterson that we basically, he didn't feel that we learned as much by emulation, but at another point he was saying that we learn by emulation rather than by words. And this is what I mean about the environment, emulation rather than the words that people are mouthing. Now, I want to say that because it's clearly the practices that a culture I was going to say practices. It's clearly the practices of a culture that determine how other people, you know, how the new individuals entering that culture are going to act. They follow the practices of their leaders or their teachers. It's not solely the content. Now, most of our environmental arguments in reference to drug use are arguments that immediately take it right back to the host or the individual. In other words, we argue that we have social inequities, that we have poverty, that we have the threat of atomic holocaust, so on and so forth. We assume that this generates anxiety in the host, who then seeks drugs to alleviate the anxiety. Now, that is not an accurate portrayal of the drug scene. As Dr. Peterson, I think, really summarized it quite well, is that people are simply following in the footsteps of their predecessors. There are new drugs, so they use different drugs, but in a sense, they're using the drugs on the one hand, as he said, as a revolution, which is simply a temper tantrum, and on the second hand, as part of compliance. It's no different to if you object to your father's being an alcoholic, that you're being, a marijuanic, and so forth. That's simply compliance. That's simply copying using a different substance. Now, this is what it looks like, is that the drug use is a copying of the behavior. Now, because we know many, many environments have the same drugs in them with a similar kind of access, same kind of environmental hazard, and yet are producing very, very few drug-dependent people. So that you can't say the culture acts on the individual who then and makes him anxious and he uses the drug for personal use. So when I talk later about what are we to do about it, I'm not going to talk about primarily the drugs, and I'm not going to talk primarily individuals, but I'm going to try to talk a little bit about how we tackle the environment. Now let's start out at one point where Dr. Peterson left off, is that what happens when a person becomes drug dependent. And what happens, as he points out, is the person quits maturing. And by maturing, he says the person quits looking at the challenges of life and looking for personal growth, and what he's looking for is personal pleasure, which is not a far cry from absolute unmitigated selfishness. Personal pleasure at some point transcends simple comfort or the necessities for living and becomes a pursuit at the expense of others. This is almost always what happens in the drug scene. I can go into that in greater detail if there are rebuttals from the floor. But what happens is when a person's maturity becomes truncated because, say, he's under the influence of drugs, there are 100 other ways his maturity can be truncated. But presumably we're in the business of growth as individuals, growth as a society, and growth is more of a moral measure than physical measure. And the growth is really basically the ability to withstand inconvenience and give of yourself to others. In other words, to be your brother's brother is what growth is all about. Now, there's no drug in the abuse scene in which use facilitates a person's ability to communicate or interact with another. Every one of the drugs, either because it stimulates internal mechanisms or it turns off the ability to read the environmental mechanisms or influences, it makes a difference of which end of the organism it's working on, to stimulate sensations or to cut off sensations. It does prevent the person from a meaningful interaction with the environment. It does, apparently, in the eyes of many, lead to the opportunity for having a profound personal experience, and that is good to a certain extent. I'm not against profound personal experiences. I'm not really against pleasure all that much. But the person gets cut off from interacting with others. And when this happens, problems start, and they tend to start within the very social group in which the person is. If the person is young and not married, it's usually his associates on the college campus or his peer groups in high school or whatever. If he's married, the problem tends to be within the family or within the home. If the person has become chronically desocialized, which happens to many individuals that have a chronic drug problem, the primary drug problem still being alcohol, is if they become chronically desocialized, they become a problem to environmental agents like social workers or to the police officers or public health officers rather than to their friends and family. Now, basically, I'm saying the same sorts of things that Dr. Peterson has said, except I'm going to look at it a little differently, is that drug use prevents the person from attending to legitimate authority. Now, I'm not going to argue that all authority is legitimate. It obviously isn't. And much authority is used for illegitimate purposes. But there is some legitimate authority, and if it's eradicated, society doesn't exist, and you have a dog-eat-dog kind of world. We've seen it. You can go to Bedford-Stuyvesant and see it if you'd like. Now, The second thing that drug use prevents a person from reading is affiliativeness. He becomes unable to see friends as his friends, and I'll get back to that in a moment. And the last thing that he becomes unable to do is share the cultural values with another. Now, when a person drops out as a consequence of drug use, and my argument is the dropping out is a consequence, not a cause. Most people who are dropouts and using drugs, you can fairly clearly demonstrate that they were using drugs before they dropped out, if you just take a historical narrative. And when they drop out, you can describe them in three nice generalizations. They attack legitimate authority. They have no respect for any legitimate authority. They generally have cut all their ties with their previous friends. They have very little in the way of friends or close associates, and they tend to have very little in the way of any kind of a value structure. So dropping out is rejecting legitimate authority, rejecting affiliative ties, and rejecting certain ethical values. Now, when this happens, when a person drops out, and when I talk about dropping out, I'm not talking predominantly about the youth. Somewhere around 1 out of 10 adult males in this country has dropped out. That's the incidence of alcoholism in this country. It happens to be the highest in the world. And most of you have seen, or many of you have seen in your own families, alcoholics, and you know darn good and well that they don't accept any legitimate authority. They are quite willing to sacrifice personal friendships and argue values out of both sides of their mouth, as Dr. Peterson argued, and I certainly argue we should not be emulating this practice. But when a person drops out, something happens. And here I'm going to get a tripartite view, and I'm going to talk about, this is the person with a drug dependency. This is his closest friend. I'll put affiliation because it might be his wife. If he's a very young person, it might be his parent or her parent. If the person has lost parents and lost friends and is not yet married, it's probably a school counselor or a social worker. This is whoever's closest to him in his living. And this last we'll just put in professionals, like who people go to see for help, and I'll get back to that in a little bit later. And when a person drops out, he begins to provide a problem for others because he's there in body but not in spirit. And not only that, his body is pretty disruptive and requires some kind of action. Now, most of us, when we see a person who's disturbed, most of us are altruistic, especially if it's somebody from our in-group, some of the kids we run around with, or one of our own family, or if we're a social agent, they're part of our society. And many of us view most people in this country as, our friends, many of us really are our brother's brother. So that when we see somebody in trouble, usually we offer to help. So that I'm saying that the drug person, and again, I'm not saying that all users of drugs get into trouble. It looks to be about 10% of the users of any particular drug gets to be in trouble. But when he does get into trouble, he drops out with what I've told you, and we'll just put a troubled person. Now, I can show you this identical model that I'm going to show you now. We have brilliant research on it in the area of schizophrenia and in other areas of health. Is it mental retardation, cerebral palsy? You name the particular pathology. This is not exclusive to drug use. This is human response to human beings when there's a troubled situation. This requires that they be social species. When the person is in trouble, the people closest to him offer help. We all understand so far. Some offer to help. Now, when a person's in trouble, he does not accept help. And this is where most of you probably will begin to get into a little bit of trouble, because you'll find that when you offer help to a troubled person, usually you get hostility in return. If you try to help an aged person across the street, they tell you, "What do you think I am, an old lady?" And the answer is yes, I really did, and I was hopeful that I could be of some assistance. Or if you tell your dad or your husband or your boyfriend, "I think you drink too much," They say, what do you think I am, an alcoholic? And the answer is yes, I really did, and I was hopeful that I could be of some kind of help. And most of you back off and say, no, 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 I wasn't really trying to say that, and in all honesty you were, and you'd be much better off if you kept to being honest rather than immediately yielded. So that the typical response to help, if the person is troubled, is hostility. Now we have a great message on this. It's the story of Jesus and the story of the crucifixion. And if there's ever a story that illustrates that if you go around offering help to others, you should not expect pats on the back, you should not expect gratitude, then I don't know what the story is about. And what happens is many of us are in the business of living for the wrong purpose. We're not trying to help out of a sense of personal growth, out of a sense of spiritual salvation. We tend to try to help because we want to get something out of it. We want to be appreciated, we want to be approved of, or if I'm a professional, I want to be paid, so on and so forth. Is that usually the person expects to get something out of it, and when he doesn't, he gets out of the ball game. Professionals will not treat drug-dependent patients because they don't pay, is the long and the short of that. And families tend to expel people with drug dependencies because they're a nuisance and they don't appreciate the family and the schools. You don't have to get rid of them because they don't appreciate the school system and so on. Most people who offer help are offering it for the wrong reason because they expect gratitude. And that's not why you should offer help. You should offer help for your own salvation, not necessarily the other person's. Now, most offers of help are met with hostility. Now, most of us persist out of a sense of love. Most wives that I've met have tried for years and years and years to be of assistance to their alcoholic husbands. Most parents, frequently without understanding, have tried and tried and tried to help the kids that have particular problems. And again, I don't care whether the problem is drug dependency, mental retardation, schizophrenia, academic problems, or what. Is they've tried to help, and they're getting chronic hostility. Now, disturbed people always attribute their troubles outside of themselves. You know, the Nazis had the Jews, the Southerners had the blacks, and the alcoholic's got his wife, the student drug user's got the stinking society. Everybody projects the responsibility elsewhere. That's, again, the hallmark of being troubled, is seeing your problems as externally caused. Now, the helper rarely sees his problem as externally caused. And they begin to ask themselves the question, well, I'm trying to help, and it's doing no good. So maybe I should ask somebody else to help me out. So they become what's called ambivalent. And those of you who have taken abnormal psychology know that the parents of schizophrenic kids are described as being overprotective, meaning trying to help, and become ambivalent, which means beginning to question whether or not they should be in this ball game because nothing good is coming of it. So that typically they go in to see a professional. At this point, I haven't done the social isolation bit, which always happens because of repeated embarrassing situations, but at some point in the sequence, they go for help to a third party, one of the helping professions. And then here we have another characteristic problems. This is usually, seek external help or go see the doctor kind of phenomena, see the school psychologist, or go see the assistant principal, or whatever it is you see as a referral agency. Now this is an interesting situation because remember, the disturbed person doesn't look disturbed. He's got a simple answer to all his problems. If it's the wife bringing the disturbed person to the professional, is that usually the wife is really concerned. She doesn't know for sure what to do. She's asking questions, should I do this or should I do that? And she's really in a neurotic conflict. She has competing kinds of ideas going on inside her, and she really is quite disturbed. Usually the disturbed person isn't. You ask them, do you really think you have this problem? He says, no, it's that. And then I can give you a whole string of obscenities saying, essentially, it's that wife of mine, she's trying to dominate me, and she doesn't love me anyhow. And you look, and by golly, it's true. She is clearly trying to take charge. It's only because he's abdicated. And by golly, she's really basically asking, should I continue to try to work with him or shouldn't I? Now, I think these are very sensible questions to ask after your efforts have met with chronic hostility. And if you're not part of the family, you say, just wash your hands of it and say, I'm getting out of this thing, you can sink or swim, Charlie, which happens to a lot of the youth. The youth are offered help, they get very hostile, and then people dump them because they're not part of the family. And I am not an advocate of that. But the people who try to work with people who are troubled are chronically met with hostility and begin to question their own efforts. They go in and see a professional. Professional sees one disturbed person, one very contented person, smiling, nothing's wrong with me, it's just my wife, or it's just the school system, it's just everybody else. And they're usually content in your office. I've never seen anybody brought in for a drug problem who really felt he was disturbed, he really felt other people were disturbing him. And what happens is the professionals very systematically underemphasize how sick this person is and very systematically overemphasize how sick the referring person is. And so you always get statements, they always turn on the referring agency and say, if you only did such and such, he wouldn't have this problem. So they turn on the school system, they say, you change, and then none of these kids will get strung out on heroin or shoot up on speed or smoke pot or whatever. And it just isn't quite that way. Now, let me talk about what we're to do about it. Now, you cannot have a drug problem without all three of these factors. It's just impossible. You can't have a drug problem if there were only drugs and no use. You've got to have people. And you can't have a drug problem unless the use is such that it increases the probability that the person will be troubled. And usage of drugs in this culture clearly biases a person to have problems. The Peruvians use cocaine without much problem. The Italians use alcohol without much problem. In fact, they use alcohol in greater quantities than we do. Jews use alcohol and have almost a zero incidence of alcohol problems. Mormons don't use alcohol and don't have an alcohol problem. So there's another solution. But, the WTCU people are right. If we could rid the world of the drugs, we would get rid of the problem. But I'll get back to that simplistic solution. If we rid the world of people, we could get rid of the problem, too. But it looks very clearly to be the cultural practices involved with drug use. Now, I'm going to take a simple statement now and hope to draw on a lot of what Dr. Peterson said, because I don't have time to spell out the picture for you. But the message we're giving people through emulation and through what the drug companies are trying to do, and they're doing it damn well, through what the breweries and the distilleries are trying to do, and they're doing it damned well, and what the people on the street market are doing, and they're doing it just as well, is they're trying to argue that you should use drugs for your personal pleasure. Now, I submit, when anything is set up where the sole use is for personal pleasure, that we better begin to ask about it. Because if the women's lib movement is beginning to question whether or not, women should be used for the sole personal pleasure of males, which is a good argument, I mean it, is that, we don't tolerate that kind of exploitation of people. And if you look at our major social problems now, the women lib movement being one of the most recent, is that they're all concerned about exploitation for selfish personal reasons. The women are getting tired of it. The environment is just about to be destroyed as a consequence of the rape of the environment by all sorts of industrial and personal use of the environment. Even simply throwing the beer can is a simple personal selfishness. You're too lazy to keep it in the car until you get home and dispose of it properly. But so is strip mining, equally as a ravage. Now, you look at the ecology, the racial and social situations are clearly exploitation of some people for the benefit of others. It's this use for personal reasons And that's the drug problem also. That's the big hang-up. And the first step you always have to make in recovery programs with addicts is simply to tell them, look, you aren't in control and that you need to subordinate yourself to some higher power. Now, AA has taught this for 30 years or more, and they got labeled as religious fanatics because they were talking about higher power. But that's what, the nationalistic movements are talking about. Placing yourself in the service of some higher power. Or if you read like John Gardner's Self-Renewal, his solution to the dilemma of self-affirmation versus group control, emulation, have your temper tantrums or just simply conform, rather than to continue to grow personally, viewing life and its experiences as a growth opportunity, his solution to it is to place yourself in the service of some worthwhile ideology or worthwhile goals. And when you are in the drug area, you find that, by golly, we're going to have to come up with different solutions than we have in the past. And you'll notice that spiritualism is frequently the solution and is commonly employed by the young mystics in the psychedelic scene. Typically, we've approached problems by trying to rid ourselves of the agents, immunization or prohibition legislation. Or after the Freudian Revolution, we were trying to indoctrinate people or to immunize people from the agents. But now we've just got the problem, and the terribly nitty-gritty problem of, I think, changing the environment, which is scary, because it looks like we may be destroying it, and that you don't want to start manipulating the environment without some grave misgivings about your power to do this and the consequences of any particular manipulation. Now let me first tell you what happens if you enter rehabilitation. Now, I can't give you figures for the psychedelic scene. We have plenty of figures from the central nervous system depression center, LSD, but I haven't talked how the culture patterns LSD, and you can decrease the problem of LSD problems by changing certain usage patterns. In other words, the drugs aren't all evil or all good either. Now, with the central nervous system depressants, we know that if you went to seek psychiatric help, traditional psychotherapy, which I'm just going to pull psi and therapy. This is the kind of therapy offered by physicians, by psychologists, and by social workers. The notion being that there's something inside you that makes you take these drugs rather than they were forced on you by an environment, which I think is the case. But they say something inside you makes you take these drugs, and if we can ever find that something, that you'll stop taking them, or you can return to social use of it. Now, we know from the studies at Lexington, Kentucky, that they were getting about a 5% recovery rate with narcotic addicts, holding them there. And they have all sorts of excuses and alibis why this happened, but don't believe them. Now, also, you'll notice that most practitioners will not treat alcoholics. And the answer they give you is because they don't get better. Which is, even if that were true, we shouldn't turn our back, some people. But in what studies exist, the recovery rates are about 5%. So I'm arguing that treatment of alcoholism, the recovery rates are just as good as treatment of narcotics problems. Now, you always have to compare your treatment rates with a spontaneous recovery rate. In other words, how many people get better without any treatment at all? Now, what studies we have suggested that about 10% spontaneous remission rate. A lot of guys that are all strung out on heroin do give it up. Malcolm X was an example. I've known enough jazz musicians that have given up heroin that about 1 out of 10 have become hooked somehow or other, have it in their capacity to get unhooked. Ditto with alcoholics. But what's this? The people we're referring to have a less than, are doing worse than if we left these poor people alone. And I believe that. And so does Dr. Peterson. And so does everybody I know who's active in the drug scene. Because these guys give alibis, excuses, personal ways you can rationalize your rotten behavior, which is basically disturbing other people. I haven't gotten into that whole ethical schmear, but drug users do really screw things up for others. is that they just excuse the behavior and do not give the person a way out. Now, if you look at simple intervention, like somebody rattling the guy's cage and saying, look, your behavior is intolerable, you fell under my Christmas tree last year, and if you're going to drink like that, don't come back. And you know what kind of response you'll get to that. You'll get a hostile response. But, you're doing a person a favor by telling them the truth. Look, only a drunk falls into the Christmas tree. Are you trying to say I'm an alcoholic? Yes, and would you please get treatment for it and come back and don't fall into my Christmas tree? Please enjoy the party. Would you please? Don't ruin it for yourself and others. Simple intervention, like being picked up by the police for public intoxication, having somebody tell you right out to your face you're drunk or you're gassed on drugs, or somebody just telling you the truth, that your behavior is intolerable and there's no reason why we should have to accept it. Any kind of simple intervention, anti-abuse therapy for alcoholics, condition aversion therapy, anything that says you got a problem, do something about it, gets about a 20 to 25% recovery rate. Now, we don't have figures on that here, and I'll have to leave that empty for the moment, but I will be able, I think, to demonstrate to you that the recovery rates are probably the same because we have some stuff at the other end here. Now, anybody who intervenes in the problem and says, look, you've got a problem, and here's a way out. And every program that I know of that's a rehabilitation program for drug problems, the way out is to commit yourself to others. Like in AA, is it the 12-step in the program is, it goes like this: having had a spiritual awakening as a result of applying these principles, I now will practice them in my daily life and will carry the message to others, which is being honest with them. You're alcoholic, you can get changed too. And I'm pointing out here the spiritual awakening comes as a result of following the program, and the following the program is giving to people. It's a very, it's the kind of program that's part of any religious process that I know of, and you get your spiritual awakening from this kind of commitment to other people, not shortcutting it with drugs, which gets you in trouble with other people. Now, any program that does this on with an unselected population, so unselected, it's saying that the problem is the problem, and it's saying here's the way out. The lowest recovery rates reported are 30%. Again, we don't have comparable figures here, but I'll get back to that in a moment for the narcotics. Now, if you can select your population, if you can take people who have previous to the drug use, had some semblance of normal adjustment, in other words, had friends, had something that resembled employment, or at least were actively involved in the school system and so forth, and many people don't have this. There are many people that are just chronically desocialized before their drug use, and the rehabilitation potential for them is bleak. But AA programs and state hospitals in this system can't select their population, and they're having about a 30% recovery rate. But when in the private treatment centers and any treatment center that selects this population, you have a 60 to 70% recovery rate. In other words, you have a selected population in which you say, you got the problem, and here's the way out. And the way out is, personal growth, is willing to not be selfish, willing to give of yourself to others. And this is spelled out through taking personal inventory and trying to correct your, quote, character defects. Now, the interesting thing is that this is the same thing that's happening on the narcotic scene. Dietrich, who has set up Synanon, is a recovered alcoholic. He knows the AA program, and he just changed the language a little bit and delivers it to narcotic addicts. He reports a 95% recovery rate. Well, we know that of the people who enter the door, 25% escape out the window. They're held captives, essentially. See, the professional says, gee, we have to hold these guys captive, therefore they'll never get better. Dietrich says, we got to hold them captive or they won't. And so 75% of the people he's able to hold captive come out rehabilitated. But 25% go out the window. So you correct for the attrition rate, and it comes out to be roughly 70%. And he's treating just as long, holding these guys captive for about 2 years, And, the federal government, when they held them captive for 2 years, had a 5% recovery rate. And it's because these guys were all the psychoanalytic guys, oh, gee, you got a problem, how are you going to get out of that one? And Dietrich tells them, he says, look, you ain't grown up. Dietrich says, act as if you're mature. At least act as if you're mature. In other words, don't have temper tantrums all the time when you don't get your way. Don't act selfish. And then he says, at least act as if you care for your fellow man. And at least act as if you're responsible. And you all know, through emulation, you can become what you emulate. So you all really, many of you, the young drug users are really becoming their sick adults because they're basically emulating them. I mean, if you really want to be different, then let's really promote active involvement with each other. Now, I got 5 minutes. I'm going to skim this. I'm going to skip along the tops of icebergs. Okay, what can we do? Can we get rid of drugs? And the answer is no. We tried to get rid of alcohol. We can take the cyclamates off because our whole, it isn't part of our ecology. But alcohol, if I started citing you, like the alcoholics support the police department, they support, half the magazines in this world and so forth, is that we pull them out as, man, is our environment going to shudder? And we tried it once, and the response to this is organized crime. And if you really want to try prohibition against marijuana or LSD or heroin or alcohol or any of these drugs, expect organized crime. And our society has experienced that, and we decide the drugs are better than organized crime. That doesn't mean we think drugs are good because we aren't going to play cops and robbers with the drugs. It just means we can't. So that's not our answer. If we could do it, we should, but we can't. So quit complaining that we don't pull all this stuff off the market. It was tried once, and we still have a lot. We still have, Las Vegas and a lot of things to show for it. Now, the other thing we've tried is working with the individual. And here what we've done, we've given all this money to big government and big education and asked everybody to change the individual. And this can't be done. Our educational programs have been a fiasco. I am not the least bit interested in dumping the whole drug education business on the educational system. My black friends tell me, who I work with in a methadone maintenance program, that their problem is that the white guys see all the solution as through government instruments and through educational instruments, and this isn't going to work. And what they advocate is healthcare systems that really are constituent systems. In other words, healthcare systems of the people, by the people, and for the people, rather than by the government, for the people. Now, this is the ball game I'm in. I head up a treatment center. Basically, we're trying to have a constituency process. We're trying to work directly with the community members. We're trying to develop early recognition, early case finding, early treatment, honest confrontation, honest involvement. We're trying to get away from the whole business of viewing treatment as a place and trying to get back to the business of viewing treatment as a process. And the process is growth. The process is self-renewal. The goal isn't pleasure. If pleasure is your goal, then your utopia is going to look like a pasture of well-fed cows. And I just don't see that as a good image to try to follow. I really do want a pluralistic society. I really do want healthcare systems and any other kind of systems like educational systems that are relevant. And it does look like we're going to have a pluralistic education system, so we can't come up with a single drug curriculum. Because what I could show you all that would hit you about, relevantly about a heroin problem wouldn't do anything for a kid from Bedford-Stuyvesant. He'd look at it and it's irrelevant to him, and that's just not the appropriate educational vehicle. Educational vehicle has to be relevant, and the only way I know that can be done is by directly involving the local environment, so the local constituents of the problem. I like constituents better than clients. It makes it clear that we all have the mutual responsibility to each other and that we aren't simply depositing people in a place. Dietrich, loved his guys enough to make them shape up. Presumably, let me just end on one formulation, is what we've tried to do is we've tried to take the position of we'll give you the facts and let you decide. And I can't give you the background for this, but at least entertain it as a possibility. is when you advocate this, you're advocating a philosophy of selfishness, of self-determination. You decide. Like, if I know how to rape the world of tin, I'm going to do it. Anna in 1,000 Days, Sir Thomas More kept saying, don't tell Henry what he can do, tell him what he should do. And see, that's what I think we should be doing, telling people what they should do, not what they can do. Now, we have city-county general hospitals, and we have civil servants, and I'm a civil servant, and I work out of the city-county system. I like being a civil servant. Is that civil service, and city-county hospitals exist not because we know how to take appendix out, or not because we know how to treat heart attacks, but because we presumably have an obligation to deliver this service to all people, not just those who could otherwise afford it. In other words, hospitals should stand as a tribute or as a monument to our commitment to each other. Ditto with the school system. We don't have schools, public schools, and incidentally they're compulsory, and I do believe in compulsory treatment, I'll make a little aside on that. The only people we make shape up are people we love. Like, the only people that we didn't force to go to school were the disenfranchised, like the black, the Puerto Rican, and so forth. The only people we forced to go to school are the high-income whites. And the others will decide for themselves. And whenever you leave, you say, just decide for yourself. You're letting the person die, basically. In other words, we should be creatively involved with each other. Now, the only reason we have school systems, the only reason we have general hospitals, the only reason Augsburg exists, and I hope the only reason that you're all here, is because we do, to some extent, want to keep trying to be our brother's brother. And the problems are that, we are constantly victimized by our ethos, emulation of getting what you can out of whatever is available, of exploitation. And I really am standing up here hoping to counter the simply give them information approach. I think we should continue to tell people what they should do and not simply tell them what they can do. So that's, I guess, what I'm going to say tonight.